Greetings, everyone. I'm Jed Shlackman. I'm a holistic counselor and spiritual energy healer. In this video, I want to speak about a term or phrase that's become sort of a buzzword or popular in the mental health field. This is the term trauma-informed care, and I want to provide an explanation of what that means, of what it's actually referring to or talking about, and how it applies to treatment models for assisting people that are having mental health challenges. First, we have to look at the idea of trauma. And trauma is what someone experiences when they have some type of stress in their life that's overwhelming to them. So it depends on the person's ability or preparedness, the resources they have to process or digest whatever the experience is. So if you have something you're not ready to fully process and integrate at the time that it occurs, if it's overwhelming to you, then you have some form of trauma reaction or trauma response, you could call that. So trauma is based upon the interaction between the person experiencing it and the events or environment that they're encountering. So there isn't a type of event that's automatically traumatic. It depends on the person having that experience and how well able or prepared they are to process that, to integrate that experience, and to move beyond it. That's just kind of a basic understanding of what trauma is, how it functions in our life. And with that in mind, we're going to look at mental health, in particular diagnosing mental health disorders and how those may typically be treated. So if someone comes to a therapist or a psychologist or counselor or psychiatrist, they're often assessed to give them some type of mental health diagnosis, especially if there's an insurance system involved where the provider receiving payment for the service depends on having some type of diagnosis. So someone might be given a diagnosis related to depression, anxiety, bipolar depression, schizophrenia, a substance abuse or addiction type diagnosis. It might be a phobia, it might be an eating disorder. There's obviously numerous diagnostic labels in the mental health field that might be used to describe a person's symptoms. And the symptoms are the concern that's being brought to therapy in a sense. A person is feeling a certain way, or they're having trouble in their relationships, they can't concentrate. Whatever's happening, it's a set of symptoms that are being assembled to help form a diagnostic label. Now, when that label is given, the therapist, the clinician involved, they have to look at this and say, okay, what approach am I going to offer to help this person, to help them deal with these challenges, perhaps to help them recover from or overcome whatever distress state they're going through. So there's many different paradigms, in a sense, or theoretical models that are used in mental health. And in the past several decades, the models that have tended to be dominant are first the cognitive behavioral models, So those are kind of looking at the surface of what are the symptoms and behaviors involved, and how can we use some form of mental, psychological reprogramming, in a sense, to change those. So there might be some type of reinforcement system present, some type of cognitive restructuring where you're trying to change your way of thinking about something. So some of the more typical talk therapy approaches would be present there. And another theoretical approach is more biologically oriented, and it's the pharmacological approach, the one most commonly applied by psychiatrists who are using the diagnosis to prescribe particular medications that are meant to in some way counteract the symptoms. So the medications affect a person's chemistry, which at least momentarily alters their mood. It could shift their brain activity to be more focused, to be less stimulated. Different ways we can shift the activity of the nervous system for a limited amount of time. So those are symptom-focused ways of approaching mental health, where a person has unpleasant or undesirable symptoms, and you're looking at a way to kind of attack the symptom, to do something to change that surface level behavior or emotional state. So a lot of mental health care is focused in that way. It's working kind of in the present time, looking at the symptom and how we can counteract that symptom. It could be by introducing a different way of thinking. It could be by introducing a foreign chemical into the body. It's not often looking at what are the deeper root causes of the particular symptoms or pattern of symptoms that are being observed. So it's not going really in depth into the etiology of that pattern of functioning that's presenting. It's not exploring in a more systematic way, why is this person having these feelings, these habits, these reactions, etc. It's not looking in a chronological sense at how all of this happened to develop and what could be done about that at that deeper level. Trauma-informed care sort of begins with the premise that many or most of the symptoms people are presenting with in therapy and mental health treatment are actually rooted in some form of trauma experience, and the person's reaction to or response to that trauma, how they adapted to it, how they have been seeking to protect themselves following that trauma, or seeking to avoid any further emotional pain or physical pain, whatever the trauma might have involved. So in the trauma-informed care approach, you're looking to uncover, okay, what is the trauma that's related to the ADHD, the anxiety, the depression, the phobias, the OCD, addictions, all these different mental health concerns. Where are the roots of them in trauma experiences? How do the symptoms you're perceiving now reflect the way that person reacted to trauma and kind of got stuck in that trauma response as they went forward in their life and never really fully processed, never fully integrated the past experience in a healthy way that allows them to get past it, to come back into more of a balance in their being, to restore equilibrium within themselves. So people are kind of stuck in their trauma reaction mode. They haven't developed the resilience to come back out of that and regain a healthy sense of self, a balanced way of relating to other people or handling their experiences in life in the present time. So for trauma-informed care, trauma is a major piece of the puzzle in the sense of understanding any mental health diagnosis a person has been labeled with, and in guiding how you're going to treat that. So with trauma-informed care, you're actually helping people build skills for processing trauma, for handling stressful experiences, for being able to kind of ground themselves, to be more present, to feel more safe, more embodied, more confident, more trusting in themselves, and able to navigate any relationships, any environments they may be dealing with. So you want to build that resilience in a person, as well as help them reflect or reconnect in a sense with the past version of themselves that experienced trauma, so they'll have an opportunity to reprocess those experiences and come to some point of release or peace or acceptance, where that experience is now integrated. They're not dissociating from it. They're not caught up in a continual reaction to it. They're not continually in flight mode, in fight mode, in freeze mode, in please and appease mode, whatever might have been their default for protecting themselves after the trauma. They don't have to be stuck in that. They can be more flexible in how they handle life experiences now. So it's an in-depth process of shifting the person's relationship with their traumatic experiences and shifting really their identity now, their sense of self, their sense of empowerment or ability to handle life. So if you're able to rebuild that sense of self, to bring them back into a state of self-confidence, to help them learn to calm down their nervous system, to be more present, more self-aware, to be able to use both the emotional and logical or rational side of their mind, to not have those split or fragmented, but to bring them back together so the person can actually have a mindful reaction or response, I would say, to life experience, rather than a very reflexive, overly emotional reaction. These are some things we can work on with our trauma-informed understanding of mental health. So recognizing the role of trauma and the reactions people go into after trauma, it's not meant to place that person in a victimhood state where they're blaming their mental health issue on what happened to them in the past and the other people who are involved. It's not about blaming. It's not about seeing yourself as a victim, as perpetually stuck in that state. It's about understanding the process and how you can actually empower yourself to move past that state of having been victimized, how you can become resilient and strong, how you can develop strength and wisdom and compassion, both for yourself and for other people. So it's actually realizing that trauma, no matter how challenging it's been, no matter how much suffering or um, inhibition or injury to yourself or your life has occurred from that, it also brings an opportunity for you to grow, to actually become more resilient than you were before, to become stronger and wiser, and to have more skills than you had before all this happened. So it's kind of realizing that the trauma, in a sense, as painful as it might have been, as much as it might have inhibited your ability to enjoy life over a period of time, there's actually a deeper purpose or meaning in that experience that can lead you to become more evolved, more enlightened in a sense as a human being, and also to be able at some point to be a support or model for helping other people as they encounter trauma or challenging mental health issues, so you can kind of lead them through their healing process. You can support them in their personal growth. So that's kind of a broader outlook on trauma and recovery, we'll say, on dealing with mental health challenges. If we don't face trauma, if we don't see that we can move through it and beyond it, then we kind of get stuck perpetually in symptom management and never truly healing. We may be just saying, oh, I have this disorder, this disability, this altered way of being that I'm going to have to adapt to throughout life. I might have to see a counselor indefinitely. I might think I need to take a medicine indefinitely. But those are actually limiting perspectives. They're kind of an old paradigm in mental health that a trauma-informed understanding helps us outgrow. It helps us see that we're not limited in those ways as long as we're open to going through a healing process, to working on integrating, on processing those traumas and moving into a more evolved version of ourselves. I hope that this discussion has given you some insight into mental health and trauma-informed care, and to give kind of a very brief summary of some approaches that might be included in a trauma-informed care way of thinking. You're kind of working on all levels holistically, physically, emotionally, mentally, and spiritually. So you're helping the person develop a sense of physical safety. So you're addressing their environment, you're addressing their lifestyle, their diet, nutrition, exercise, sleep habits, connecting with nature, all of those things. You're also looking at their attachment patterns, how they relate to other people, how they handle interpersonal stress or interpersonal interactions. So you're also considering their beliefs, both their conscious and subconscious beliefs, what they believe about themselves, about their environment, about other people, and working toward shifting those beliefs into ones that are really more balanced, more reflective of any objective reality, and giving them some resources to handle their experiences, to be more flexible in a sense in how they're able to respond to people around them into their environment, and also looking at people's spiritual understandings or concepts or practices, working with things like mindfulness and meditation, with affirmations, with prayers, with things that help a person feel connected to and supported by what one term we apply would be like a higher power. For religious people, it might be God. Some people might call it source or creator, great spirit, whatever label we want to put on that spiritual source and the resources that we envision we're connected to there. That's very often a part of trauma-informed care, since that's very deeply related to our sense of self and how we look at life. So spirituality and religion can be either supportive, they can help us with our mental health, but if we have beliefs or concepts about those that foster fear or a sense of something being wrong with oneself, a fear of judgment, feeling sinful, feeling rejected, then those aspects could have a contrary effect on our well-being. They could actually foster the mental health issues. So it's important to look at the spiritual dimension and how it could be supportive, or we can build it to be more supportive rather than being something that actually fosters some form of self-rejection, some form of judgment toward ourselves. So the trauma-informed approach includes many different healing modalities. It's not intended to just treat a symptom, so usually the pharmacological approach plays a limited role, if any role, in working from the trauma-informed model, since you could see that there's actually a significant risk involved with placing people on medications to treat symptoms. It's somewhat similar to when people have trauma and they experience some form of suffering, that they resort to using recreational drugs as their approach to reacting to their trauma. They're trying to escape from it or numb their emotions, and we see how that creates harm. It kind of stunts people's growth or development over time. So we don't want people to fall into that type of pattern using the prescribed drugs. And unfortunately that does happen often, where people have the prescription medication dependency that's in some way interfering with or inhibiting their personal growth, their ability to actually face experiences, to reprocess unpleasant memories, so that those things are no longer controlling them, no longer triggering the self-protective responses that might have been needed or useful at the past juncture when something occurred, but now they're kind of stuck in that pattern. They've become rigidly caught up in that default way of reacting, and it's interfering with their ability to function in life. So that can happen both with the recreational drugs and with prescribed pharmaceutical drugs. There isn't any fundamental distinction between the legal or illegal or prescribed or recreational drugs. They're all drugs that are used to shift our neurological activity and psychological state in a temporary way, that can have negative long-term implications. So if you're looking at things from the trauma-informed model, you'd want to shift or gravitate away from the pharmacological treatment approach, maybe using that in short-term emergency situations if you don't have any other options. But for the long term and for healing, you want to help people develop inner resources, inner strength, to develop resilience and a healthy sense of self and their place in the world, a sense of meaning and purpose in life, and a sense of connection to their community and to a higher dimension of existence, even if it's just a humanistic concept of being connected to the human race as a whole, or to nature as a whole, for those that don't believe in a spiritual intelligence. If we feel connected to something greater than or something beyond our individual self, that's a very valuable resource in our healing process. For those that are interested in learning more about different approaches for healing mental health and physical health concerns, and of course the mental and physical are always to some extent interrelated or interconnected, since body and mind are just different aspects or layers of an integrated feedback system. So your physical health affects your mental health affects your physical health. So the holistic understanding appreciates that and provides a range of healing methods to support the whole system, to not just focus on a symptom, on only the level where a symptom may appear. So my holistic wellness website is phinsights.com, phinsights.com. You'll find information about many different topics there and about the services I offer and events I present. You can also view other videos that I've uploaded on the platform you're viewing. For now, I'd like to wish everyone a wonderful day. Namaste.